Welcome to the Brain and Spine Neurosurgical Institute. Our goal at BSNI is fairly simple. We want you to have a thorough understanding of your condition. Patients often leave their doctor's office confused and with many questions. We want you to have an effective knowledge of your diagnosis and your course of treatment, so that together we can work as a team to address your concerns. Today, we are going to discuss the anterior cervical discectomy with fusion. Our visit starts with a thorough examination. Patients often present with pain, radiating down from their neck out into their arms. This pain is often due to the compression of a nerve. Often, we can identify the source of this pain by looking at an MRI. Let us review what we see in an MRI. The spine is made up of a group of vertebrae, or small bones, stacked one on top of the other. These vertebrae are separated by cartilage, a spongy material that provides cushioning between the bones. In this particular picture, the vertebrae are brown and the cartilage is white. The vertebrae surround and protect the spinal cord, which is seen in yellow in this picture. The spinal cord is made up of a collection of nerves. The spinal cord is surrounded by fluid. This fluid is almost like a protective balloon. In this picture, we see the rapid progression of a herniated disc. The discs of cartilage between the vertebrae are constantly supporting our heads and necks. Over time, this pressure can result in one of these discs being forced out of place and into the spinal canal. As it continues to bulge, this disc may press against a spinal nerve. This compression often results in arm pain. In this MRI, we can see that the patient has a relatively significant disc herniation that is pressing against the spinal column. The procedure is conducted with the patient lying on his or her back. By approaching the neck from the front, we can limit the amount of disturbance to the muscles surrounding the spinal cord. A 1 to 2 inch incision is made at the location of the herniated disc. Retractors are then placed to separate the muscles in the neck and gain access to the anterior or frontal portion of the spine. Next, we address the specific location of the disc herniation. Here, we see a side view of the displaced disc pushing into the spinal canal. With a device very similar to that seen here, we remove the entirety of the herniated disc. This process is known as a discectomy. With the disc having been removed, we restructure the spinal canal using a fusion process. By promoting the fusion or joining of the vertebrae above and below the site of the discectomy, the patient is able to regain mobility and flexibility in his or her neck. This process begins by drilling into the bone. This is done very carefully so as not to disturb any surrounding structures. We then place a fusion cage at the site of the discectomy, which will help the fusion of the vertebrae to progress quickly. Small pieces of bone collected during the procedure are then placed around the cage to further aid the fusion. Plates and screws are added to structure the spinal cord during this healing process. Over time, these small pieces of bone and the cage will fuse with the vertebrae above and below the site of the discectomy. The spinal canal will not be obstructed, and any previously experienced pain will be reduced. The procedure will last between 1 and 2 hours and is generally done as an outpatient procedure. Scarring is minimal, as the incision is only between 1 and 2 inches wide. Patients may experience hoarseness and difficulty swallowing for up to a week after surgery. In addition, arm pain and swelling may present 48 hours after the procedure. Hopefully, this will give you a better understanding of an anterior cervical discectomy with fusion. The procedure is safe and very effective. If you have any additional questions, please don't hesitate to ask.